Hello everyone. Welcome to today's live presentation. I welcome my viewers from LinkedIn, Facebook as well as YouTube. And today I am going to speak on very interesting topic, and that is ImmuLIT. Is it an alternative to IVF treatment? I am Dr. Mohan Raut. I am a gynecologist and practicing clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology in Mumbai and in other parts of India. At these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using our patented process of ImmuLIT and along with other immunomodulatory treatments. So today I am going to speak on a very interesting topic, and that is, as I mentioned, whether ImmuLIT treatment can be an alternative to IVF treatment. And the reason why I am talking about this is many times our patients ask us, doctor, if we take this treatment, can I conceive naturally? Can I avoid IVF? Can I avoid IUI? So I thought it was important to explain about this point in detail. So today I will try and explain in which cases it can be an alternative to IVF, or it can be supplementary to IVF or useful along with IVF. So before starting that, you must know what is ImmuLIT. I think all of you know, but I will briefly explain. ImmuLIT is the patented branded form of lymphocyte immunization therapy that is practiced at our center, that is Dr. Raut Center for Reproductive Immunology. As I mentioned, it is an active immunomodulatory treatment, and it is useful for couples who have unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility. And in these patients, group of patients also, only those patients are selected for the treatment where the immunological investigations indicate that there is an alloimmune cause for their reproductive failures. And these tests are, as I already explained in detail in my previous videos. We use lymphocyte cross match, which if it is negative, the couple will be benefited by this. Second is natural killer cells, where there are certain changes in natural killer cells in the peripheral blood, whether CD16, 56 is very low. Third is if the inflammatory cytokine TNF alpha is very high, antithyroid antibodies are high, the endometrial NK cells are high, and especially if CD57 positive in the endometrium. So these are the patients who will benefit with the treatment of ImmuLIT. Now coming to IVF. Now I need not elaborate more about IVF, but I will touch upon few important points why IVF is done. IVF is an advanced treatment for fertility, and it's a very effective treatment for couples who don't have a child or who have infertility. And there are different indications for IVF. Like if the most important indication is when the fallopian tubes are blocked, then there is no way the egg can go into the uterus, and in those patients IVF becomes the treatment of choice. But there are other indications for IVF, like problems with the semen, and if the count is very low, motility is very low, then in those cases the IVF is beneficial. In patients who have severe polycystic ovarian disease or PCOD, they are benefited by IVF treatment. Then there are indications related to different parts of the reproductive system, but there is a big group of indications which are advised IVF treatment, and that is unexplained infertility. That is those couples who have everything normal, all the factors that or the reasons that lead to infertility are normal. The tubes are patent, ovulation is fine, lining is good, uterine cavity is good, but still they are not conceiving. So in such cases, even the embryo quality has been checked many a times, genetic testing is done, still there is no pregnancy. So these are so-called unexplained cases, IVF, unexplained infertility patients who are referred for IVF, and they undergo IVF treatment, and many of them are successful after that. So if we consider ImmuLIT treatment and IVF treatment together, then I would like to say that ImmuLIT is never an alternative to IVF. Okay, so it depends on for what indication IVF is done. So if the IVF is done for blocked tubes, and the patient will always require IVF treatment to conceive. Now, in these patients who have been referred for IVF, if there is an additional alloimmune problem as indicated by the immunological tests, then the treatment of ImmuLIT will be required. But after that, the couple will have to undergo IVF only because the tubes are blocked. Okay, so in those patients where tubes are blocked, even after ImmuLIT treatment, IVF will be required. Patients who have severe PCOD and otherwise they have difficulty in natural conceiving, they will require IVF treatment even after correcting the alloimmune problem with the ImmuLIT treatment. But in patients who have unexplained infertility, where everything is normal, in those cases, if the immunological reports indicate that there is an immunological problem, then these patients have fairly good chance of conceiving naturally after correcting the alloimmune factor. I distinctly remember, there are many patients, but a few of them about whom I always many times mention that these patients have undergone multiple IVF cycles. One of them had undergone 5 IVF cycles. She had never conceived. And after this treatment, just in 2 months, she conceived naturally when she was to undergo next embryo transfer in the next cycle. Then there was one patient who had, I think, 3 IVF failures, and she immediately after the LIT in the next cycle she conceived naturally. So these are the patients who have been referred for IVF for a specific reason, that is unexplained infertility. In those patients, if the immunological factor is present and if that is corrected, then that those patients will, there are good chance that they will conceive naturally. So therefore it is important to keep in mind why IVF is done. So in patients who have multiple IVF failures because of a reason which is there, like the fallopian tube problem or any other problem, and if they are not conceiving, then these couples will require IVF even after correcting immunological factor. So if you are watching and if you have an indication which is, as I mentioned, unexplained infertility, then in those cases it is worthwhile finding out the immunological problem. If it is there, correcting it, and after that, the pregnancy can be planned naturally. Actually, in these cases, after correcting the alloimmune factor, we have a period of 18 months over which to plan pregnancy. So, in such cases, the pregnancy can be planned by naturally, can be planned with time frame, keeping time frame in mind. A particular period can be dedicated for even natural conception, and if not, an advanced treatment like IUR, IVF can be recommended. So, to conclude, I would like to tell this important point that ImmuLIT is an important treatment when there is an immunological or alloimmune factor, but it is not an absolute alternative to IVF, but it is always a complementary treatment to IVF, whether it is for any known cause or whether it is an unexplained factor. So a combination gives the best result. But yes, in patients who have unexplained infertility, who are undergoing IVF, there is distinct possibility of conceiving naturally. So if you know any patients who are suffering from similar problems, or if you yourself are facing this problem and want to know more about ImmuLIT treatment, you can contact us on our helpline number, that is 9833201522, or you can visit our website www.icprm.in. And if you share this with at least one couple who really needs it, I am sure you will help them complete their family and achieve their dream